Hello. Edutainment Studios and Access Healthcare welcome you to Insomnia, alleviating your sleep troubles. Today we will be discussing insomnia and the troubles you have with sleeping. We all know what it's like to toss and turn at night, wondering how you're going to manage the next day. But if sleeping poorly has become a normal occurrence, it might be due to bad sleeping habits or worries that are keeping you awake. There are a number of different things you can try in order to get a better night's sleep. A doctor can help you find out if the problem is being caused by a medical condition and let you know what the treatment options are. So, how do you distinguish a normal passing sleep problem from a more serious form of insomnia that requires treatment? There are typically two types of insomnia. The first is trouble falling asleep. Commonly, people have difficulty falling asleep when they can't let their mind relax and they continue to think and worry. Sometimes the body's not ready for sleep at what is considered a usual sleep time. Trouble staying asleep is the other type. People with this type of insomnia fall asleep normally but wake up several hours later and cannot fall asleep again easily. Sometimes they drift in and out of a restless, unsatisfactory sleep. Sleep maintenance insomnia is more common among older people who are more likely to have difficulty staying asleep than are younger people. It may occur in people who use certain substances or who take certain drugs, and in people who have certain sleep disorders. Insomnia is the most common sleep complaint in the United States. It often takes the form of sleep maintenance insomnia, that is, difficulty staying asleep, and in particular, waking too early and struggling to go back to sleep. Sleep maintenance insomnia is more common in women than in men. Sleep disturbances cause significant distress and impairment in many areas of functioning, including social, academic, behavioral, and occupational functioning. People with insomnia have difficulty carrying out their daily responsibilities, either because they're too tired or because they have trouble concentrating due to lack of restful sleep. Insomnia may cause a reduction in energy level, irritability, disorientation, dark circles under the eyes, posture changes, and fatigue. Insomnia is also associated with factors that interfere with sleep, such as physiological and cognitive arousal. There are multiple ways to describe insomnia. Acute insomnia is a brief episode of difficulty sleeping. Acute insomnia is usually caused by a life event, such as a stressful change in a person's job, receiving bad news, or travel. Often, acute insomnia resolves without any treatment. Chronic insomnia is a long-term pattern of difficulty sleeping. Insomnia is usually considered chronic if a person has trouble falling asleep or staying asleep at least 3 nights per week for 3 months or longer. Some people with chronic insomnia have a long-standing history of difficulty sleeping. Chronic insomnia has many causes. Please feel free to check out these sites for more information. And as always, jot down your questions and concerns and bring them in to discuss with your doctor. Thank you for joining us today for part 1 of this 7-part series on insomnia.